If you were asked to create a task force to address the rising cost of healthcare in Virginia, who would you ask to join your team, and what recommendations would you personally bring to the table?
I don't have anybody specifically in mind for task force, but as with anything, I believe that freeing the market up allows for better competition, allows for less cronyism and less monopolistic ways that the companies do, and allows them to raise the prices. If we allow for people to buy across state lines, if we do some tort reform, and if we just get the government out of subsidizing various sectors of the medical industry, then I think we will see a lot of costs go down. The government wasn't into the medical field until the last 50 years or so, and if you look at cost, in the last 50 years they have skyrocketed. Before, you would have more of a free market, and you would allow for mutual aid societies and charities and other things that would help people that cannot afford it, even when the prices were relatively low compared to today's massively inflated prices. So I believe if you, like I said, open up the free market to the medical industry, and you wouldn't have these prices going up. I mean, myself, I haven't had insurance the last few years, and it's just because it's skyrocketed so much, and we have it so attached to our work now that if you don't have a job, if you're a self-employed person, then it's a huge cost.
Raman, I think it's important to bring the big players that are healthcare providers, Inova, Centara, Carilion, UVA, but also Augusta Health Center, and bring those people together with the health insurance providers, with patient advocacy groups, with nurses and doctor associations, but also with the public agencies that administer Medicaid and Medicare, and bringing those people together to do a study on what a good healthcare profile looks like for each citizen in Virginia, and make those targets for what that looks like. What I would hopefully recommend and bring to the House of Delegates are suggestions for incentivizing healthy life choices, cessation of smoking, having a supervised weight loss and exercise program with a doctor, and also making healthy food choices. But I'd also like to begin an incremental move toward Medicare for all, because I believe that taking the burden of healthcare from businesses will allow companies to invest more in their own businesses, invest in job creation, and also invest in their own employees. And I believe having a single-payer system will take off the administrative burden from hospitals and clinics who have to deal with a multitude of insurance providers.
I think one of the problems is that we never have all the stakeholders at the table at the same time. We need hospital administrators, we need drug companies, we need healthcare providers, we need the regulators, we need insurance companies. We need all those people sitting down together trying to find solutions to this. And I'm just not convinced that that's happening. I think everybody's operating in their own little orbit when it comes to healthcare, and the results are not good so far. There are a couple of things that I'd do if it were up to me. First thing I'd do is make the industry more competitive. I'd start by repealing the Certificate of Public Need requirements. I think it's an outdated method that discourages competition, and I think in healthcare we need competition. I think if we had it, we'd see the quality go up and the costs go down. There are some things we can't do at the state level. I'd like to see us compete across state lines with insurance companies, but that's not our call at the state level. Some other things that we can do are health savings accounts. Everybody should be allowed to have one of those. Not required to, but allowed to. And we can do that. That's something we can accomplish. I think direct primary care, where patients actually contribute to a physician and then have their funds on deposit when they need the services, and maybe they never need them. It's sort of their own insurance policy, and I think that's a good idea too.
The Woodrow Wilson Candidate Forum has been brought to you by the Pearson Financial Group, because we know the best choices are made when you have reliable, accurate information. At Pearson Financial, we work hard to ensure our clients make well-informed, smart financial decisions. Pearson Financial, with offices in Stanton and Charlottesville, wants to remind you that Tuesday, November 7th is Election Day.